Hey everyone, welcome back to Speak Healthy. Today, we are going to talk about whether or not heart disease is hereditary, as well as review its risk factors. Heart disease, also known as cardiovascular disease, is a common medical condition that affects millions of people worldwide. It is the leading cause of death in the United States and many other developed countries. Although heart disease is often associated with lifestyle factors such as poor diet, lack of exercise, and smoking, many people wonder if it can also be hereditary. This video aims to explore the question of whether heart disease is hereditary, as well as to identify and analyze the various risk factors associated with this condition. By examining the latest research on the subject, this video seeks to provide a comprehensive understanding of the causes and potential preventative measures for heart disease. Number 1. Understanding heart disease. Understanding heart disease is crucial for preventing and treating this medical condition. In addition to the definition and prevalence of heart disease, there are several other important aspects to consider when seeking to understand this condition. One key aspect is the underlying causes of heart disease. The most common cause of heart disease is atherosclerosis, a condition in which plaque builds up in the arteries, causing them to narrow and restricting blood flow to the heart. Other causes of heart disease include high blood pressure, high cholesterol, diabetes, and obesity. Understanding these causes can help individuals take preventative measures to reduce their risk of developing heart disease. Another important aspect to consider is the different types of heart disease. While the term heart disease is often used to refer to a range of conditions that affect the heart, there are distinct types of heart disease, each with their own unique characteristics and risk factors. For example, coronary artery disease is a type of heart disease that occurs when the blood vessels that supply the blood to the heart become narrowed or blocked, while heart failure occurs when the heart is unable to pump enough blood to meet the body's needs. Additionally, understanding the symptoms of heart disease is critical for early detection and treatment. Common symptoms of heart disease include chest pain or discomfort, shortness of breath, palpitations, and fatigue. However, it is important to note that not all individuals with heart disease experience symptoms, and some may have only mild symptoms or no symptoms at all. Number 2. The role of genetics in heart disease. The role of genetics in heart disease is an important area of research, as understanding genetic factors can help to identify individuals who are at higher risk for developing heart disease. There are several ways in which genetics can play a role in heart disease. Firstly, family history can be a strong predictor of a person's risk for developing heart disease. Studies have shown that individuals with a first-degree relative, such as a parent or sibling, who has had heart disease are at higher risk of developing the condition themselves. This may be due to the presence of shared genetic factors that increase the likelihood of developing heart disease. Secondly, specific genetic mutations or variants have been identified that are associated with an increased risk of developing heart disease. For example, mutations in the genes that regulate cholesterol levels can increase the risk of developing atherosclerosis and coronary artery disease. Additionally, mutations in genes that regulate blood pressure can increase the risk of developing hypertension, a major risk factor for heart disease. Thirdly, genetics may interact with lifestyle factors to increase the risk of heart disease. For example, individuals who carry a specific genetic variant that increases their risk of developing heart disease may be at even higher risk if they have other risk factors such as obesity or a poor diet. It is important to note, however, that genetics are not the only factor that determines a person's risk for developing heart disease. Lifestyle factors such as a poor diet, lack of exercise, and smoking can also significantly contribute to the development of heart disease. Additionally, other risk factors such as age, gender, and underlying medical conditions can also play a role. Number 3. The role of lifestyle factors in heart disease. Lifestyle factors play a significant role in the development of heart disease. Unhealthy life choices can contribute to the development of risk factors that increases the likelihood of developing heart disease, such as high blood pressure, high cholesterol, and obesity. There are several lifestyle factors that can impact heart disease, including diet. A diet high in saturated and trans fats, sodium, and added sugars can contribute to the development of high cholesterol and high blood pressure Two major risk factors for heart disease: a diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats can help to reduce the risk of heart disease. Physical activity. Lack of physical activity can contribute to the development of obesity, high blood pressure, and high cholesterol, all of which increase the risk of heart disease. Regular physical activity such as moderate aerobic exercise for at least 150 minutes per week can help to improve heart health. Smoking. Smoking is a major risk factor for heart disease. The chemicals in tobacco smoke can damage the lining of the arteries, leading to the buildup of plaque and increasing the risk of heart attack and stroke. Quitting smoking can significantly reduce the risk of developing heart disease. Alcohol consumption. Excessive alcohol consumption can increase the risk of developing high blood pressure and heart failure. Moderate alcohol consumption, however, has been shown to have a protective effect on heart health. Stress. Chronic stress can contribute to the development of high blood pressure and heart disease. Effective stress management techniques such as meditation or deep breathing can help to reduce the impact of stress on heart health. Number 4. Other risk factors for heart disease. In addition to genetics and lifestyle factors, there are several other risk factors that can contribute to the development of heart disease. These include age. As we age, the risk of developing heart disease increases. This is because the arteries can become stiff and less elastic, making them more susceptible to damage and plaque buildup. Gender. Men are at higher risk for the heart disease than women, although women's risk increases after menopause. Race and ethnicity. Certain racial and ethnic groups such as African Americans, Hispanics, and Native Americans are at higher risk for heart disease. Family history. As mentioned previously, having a first-degree relative with heart disease can increase the risk of developing the condition. Medical conditions. Certain medical conditions such as diabetes, high blood pressure, and high cholesterol can significantly increase the risk of developing heart disease. Obesity. Obesity is a major risk factor for heart disease. Excess weight can contribute to the development of other risk factors such as high blood pressure and diabetes. Sleep apnea. Sleep apnea, a condition in which breathing stops and starts during sleep, can increase the risk of developing high blood pressure and heart disease. Chronic kidney disease. Chronic kidney disease can increase the risk of developing heart disease as the kidneys play a role in regulating blood pressure and removing excess fluid from the body. Number 5. Prevention and treatment of heart disease. Prevention and treatment of heart disease are essential in reducing the risk of developing heart disease and improving outcomes for those who have already been diagnosed. Here are some of the ways that heart disease can be prevented and treated. Lifestyle changes. As previously mentioned, healthy lifestyle choices can help prevent and treat heart disease. Maintaining a healthy diet, engaging in regular physical activity, avoiding smoking, moderating alcohol consumption, and managing stress can all help to reduce the risk of heart disease. For those who have already been diagnosed with heart disease, these lifestyle changes can help to improve outcomes and reduce the risk of further complications. Medications. There are several types of medications that can be used to treat heart disease. Some medications, such as statins, can help to lower cholesterol levels and reduce the risk of heart attack and stroke. Others, such as beta blockers and ACE inhibitors, can help to reduce blood pressure and improve heart function. Anticoagulants can also be used to reduce the risk of blood clots in those with certain types of heart disease. Procedures. In some cases, procedures may be needed to treat heart disease. These may include angioplasty and stenting to open blocked arteries, bypass surgery to reroute blood flow around blocked arteries, or implantable devices such as pacemakers or defibrillators to help regulate heart function. Cardiac rehabilitation. For those who have already been diagnosed with heart disease, cardiac rehabilitation can be a valuable tool for improving outcomes. Cardiac rehabilitation programs typically involve a combination of exercise, education, and counseling to help individuals recover from heart disease and prevent further complications. Screening and early detection. Regular screening for risk factors such as high blood pressure and cholesterol, as well as early detection and treatment of heart disease, can help to prevent complications and improve outcomes. Management of comorbidities. It is important to manage comorbidities such as diabetes, kidney disease, and sleep apnea that can increase the risk of heart disease. Follow-up care. Regular follow-up care with a healthcare provider is essential for the prevention and treatment of heart disease. This may involve monitoring of risk factors, adjusting medications as needed, and making additional lifestyle changes as appropriate. Heart disease is a complex condition that can be influenced by a variety of factors, including genetics, lifestyle choices, and other risk factors. While genetic factors may play a role in the development of heart disease, lifestyle choices and other risk factors are often more significant contributors to the condition. Understanding the risk factors and working to prevent and treat heart disease through lifestyle changes, medication procedures, cardiac rehabilitation, and follow-up care can significantly reduce the risk of developing heart disease and improve outcomes for those who have already been diagnosed. It is essential for individuals to work with their healthcare providers to assess their risk profile for heart disease and develop a personalized prevention and treatment plan. By making healthy lifestyle choices such as maintaining a healthy diet, engaging in regular physical activity, avoiding smoking, moderating alcohol consumption, and managing stress, individuals can significantly reduce their risk of developing heart disease. For those who have already been diagnosed with heart disease, a combination of medication, procedures, and cardiac rehabilitation can help to improve outcomes and reduce the risk of further complications. It is crucial to continue research into the prevention and treatment of heart disease, as this condition remains a leading cause of death worldwide. By working to better understand the complex interplay of genetics, lifestyle factors, and other risk factors, we can continue to improve outcomes and reduce the burden of heart disease on individuals and societies around the world.